Today I'm doing a Q&A session answering some of the questions you have asked me either through social media or on this channel. So if you want to ask me any questions, connect with me on social media at Dr Tasha G or on this channel and I'll try my best to answer them. So let's get started. How many types of breast cancers are there? Well, there are actually many types of breast cancer, and we talk about them depending on where they originate from. Here is a breakdown of breast cancer types according to their primary site of origin. Invasive ductal carcinoma, which is the commonest type of breast cancer, and it originates from or within the milk ducts. It then has the ability to invade the surrounding breast tissue. As I said, this is the commonest type of breast cancer that we see. Invasive lobular carcinoma, or ILC. This originates in the lobules of the breast and it can invade the surrounding breast tissue. This type of cancer can sometimes be difficult to detect, and it is the second commonest cancer that we see. Ductal carcinoma in situ or in situ, also known as DCIS. Now, DCIS starts in the milk ducts of the breast. This is a non-invasive type of breast cancer that doesn't have the propensity or the ability to spread beyond the milk ducts. These are usually the cancers that we find on mammograms. Then you have the less common types of breast cancers. Medullary carcinoma. This starts in the milk ducts or the lobules, and we can see it because it has distinct borders. It is often associated with lymphocytic infiltrate, which means that immune cells are present within the tumor. Mucinous carcinoma is another less known cancer. And again, it begins in the milk ducts or the lobules, and it's characterized by the presence of mucus-producing cancer cells. Papillary carcinoma. This starts again in the milk ducts and forms small finger-like projections. It tends to have a good prognosis. Tubular carcinoma, again, is a lesser known cancer type, and it does again originate from within the milk ducts. It is characterized by well-formed tubules, and it often has a favorable prognosis as well. And metaplastic carcinoma. This is a rare and aggressive type of breast cancer. It is characterized by a mixture of different cell types, including glandular, which is either ductal or lobular cells, as well as non-glandular cells. So these are some of the main types of breast cancer based on their location of origin within the breast. It is important to remember that breast cancer can be quite complex and may have different subtypes or variations within each type. Diagnosis and treatment decisions are typically based on a combination of factors, including the specific type of breast cancer, the stage, the hormone receptor status, the HER2 status, and other individual characteristics of the patient. Do I need a drain after breast cancer surgery? The answer to this is actually not necessarily. The need for a drain after breast cancer surgery can vary depending on the type of the surgery performed, as well as individual patient factors. In many cases, drains are used following breast cancer surgery to remove excessive fluid that may accumulate at the surgical site. And the purpose of the drain is to prevent the fluid from building up within the surgical area, which can then potentially lead to complications such as seromas, which are pockets of fluid, and also to monitor the potential of bleeding post-surgery. The common type of surgery where we use a drain is usually after a mastectomy. We rarely use it, if ever, after a lumpectomy. So, one end of the drain, which is usually a plastic tube, is placed within the surgical field, usually just underneath the skin, and the other end is connected to a small plastic bottle. Patients will usually go home with the drain, which can stay anything between 3 to 5 days, or when it drains between 30 to 50 mils of fluid in 24 hours. And then someone from the breast team will remove the drain by pulling out the plastic tube. However, there has been a trend towards minimizing the use of drains in certain breast cancer surgeries. And the decision to use drains is typically based on various factors, including the type of surgery that's performed, the extent of tissue that's been removed, the preference of the surgeon, as well as the individual patient's characteristics. Advancements in surgical techniques and practices, along with improved understanding of wound healing, have led to a shift in surgical approaches that aim to reduce the need for drains. The goal is to promote faster recovery, minimize discomfort, and decrease the risk of complications associated with drain use. It is important to note, though, that the decision to use drains is still based on individual patient factors as well as the surgeon's judgment. What is fat necrosis? Fat necrosis is a condition that can occur after breast surgery, including breast cancer surgery or reconstructive procedures, and it refers to the death or damage of fatty tissue within the breast. It can present as a firm lump or an area of thickened tissue in the breast, and it may be associated with symptoms such as tenderness or changes in the breast shape or texture. So during breast surgery, the blood supply to the fatty tissue can be disrupted. This can lead to the death of fat cells, and this can result in formation of scar tissue and the development of a palpable lump. Fat necrosis can also occur due to trauma or injury to the breast, not necessarily related to surgery. So for example, if you fell on your breast or damaged your breast by a knock, for example. And in many cases, fat necrosis does not require treatment and actually may resolve on its own over time. However, if fat necrosis is causing significant discomfort or cosmetic concerns, or if it mimics the appearance of breast cancer on imaging, then treatment options may be considered. This is, of course, something you will need to discuss with your surgeon. Do you always need chemotherapy if you have been diagnosed with breast cancer? Well, actually, not all breast cancer patients need chemotherapy as part of their treatment. The decision to recommend chemotherapy depends on several factors, including the characteristics of the breast cancer, the stage of the disease, and individual patient considerations. The main types of breast cancer that typically benefit from chemotherapy are early stage breast cancer with high risk features such as a large tumor size, lymph node involvement, higher grade, and certain molecular features. If a cancer is hormone receptor negative, and this is because hormone receptor negative breast cancer, which include tumors that do not have the estrogen receptor and progesterone receptor, as well as the HER2 receptor, are less responsive to hormone therapies. So, chemotherapy may be recommended to target these tumors. HER2 positive cancer. HER2 positive breast cancer refers to tumors that overexpress the HER2 protein. Chemotherapy, often combined with targeted immunotherapy like trastuzumab, which is Herceptin, or pertuzumab, which is Perjeta, as well as Kadcyla, is typically used to treat HER2 positive breast cancer. Chemotherapy may be used in locally advanced or inflammatory breast cancer, and these are more advanced stages of breast cancer. And chemotherapy is often part of the treatment approach to shrink the tumors before surgery or to treat the cancer that has spread to lymph nodes or other areas. Now, determining the need for chemotherapy is actually quite complex, and it involves assessing various factors. Oncologists can use predictive tools such as the gene expression profiling test like Oncotype DX, for example, or clinical assessment based on the tumor size, the lymph node involvement, as I mentioned earlier, the grade, the hormone receptor status, as well as the HER2 status. The patient age can also be used to estimate the risk of cancer recurrence and to guide treatment decisions. And as you know, treatment decisions are very individualized, and a comprehensive evaluation of the patient's overall health, their preferences, and the potential side effects of treatments is also considered. I hope this has been helpful, and I'll catch you in the next one. Take care.